Dr. Friberg, welcome. It really is a pleasure to see you.
Good to see you.
Yeah, unfortunately, we're not all, in the offices now. At least I'm not. So I usually see people frequently, but it's nice to have a chance to do this. But I'm impressed even just reading your bio, and I've known you for a long time now. And you forget how, I mean, these are the top universities across the country that you went to. It is impressive. We really have outstanding faculty, and you certainly are amongst those. And you are, you went through this. You did a lot of education, had an engineering degree, and then went to medical school. Tell us a little bit about all of the things that led to your inspiration to do both of those things and ultimately dedicate yourselves to caring for patients.
Well, I was always interested in fixing things and how things work. So that kind of got me into engineering. I did pretty well in school in physics and mathematics. So I thought I would go and see some graduate education in engineering. So I went to Stanford. And there, it was a lot of fun because there were a lot of really smart people doing a lot of really cool projects. And I got involved in a project with NASA way back when, and they were reattaching retinas in dogs using a centrifuge.
Wow.
Essentially strapping a dog into a centrifuge, the ones that humans would be using as well. And so the dogs would go for a nice ride, and we would see whether the centrifugal force would help reattach retina. I didn't know anything about retinas at the time, but it was a really cool project.
That's amazing. And is it often that you put those, now that you're not just doing clinical work, you're also doing research and you're contributing in many ways, both clinical research, and you also have some work that you're doing in the bench work as well. How much has that engineering background influenced some of your work that you're doing academically?
Oh, well, it's helped a lot. I mean, engineering is primarily having a problem and then trying to figure out a way to solve it in a reasonable fashion. And so I have used along the way many times my engineering training. And it's been fun and quite rewarding. And also, working with bioengineering students is also a big kick for me too.
Well, tell us a little bit about that, because I know you have some projects that involve engineering and involve, new therapies and possibly some new delivery systems and things to help patients. Share with us a few of those things that you're working on that we may be looking forward to in the future.
Sure. Well, I've had a lot of experience with macular degeneration along the years. So one of the issues with macular degeneration is it's treated typically with injections, and giving injections every month or so is not so fun for the patient. So having something that lasted a lot longer would seem to be a good goal. So I was working with some of the bioengineering folks trying to come up with a compound that could be injected just like we inject normal medication into the eye, but the compound would make it last longer in the eye for several months, hopefully. So that was fun. And we had some success in animals and so forth, and we ultimately got a patent on that, so it was a viable strategy. There are other strategies out there that are competing, but we were happy to come up with that, and it is patented.
Well, and do we think that this is something that patients would benefit in the getting a patent's the first step, and what are the next steps, and what do we hope to be able to see? That certainly sounds like a great idea, to be able to have something that patients wouldn't need to have injected in their eyes so frequently, right?
Right, but in order to get things approved, it's a big long process. So if you put a medication within another substance, essentially you have to get an FDA approval for the whole thing. So it's expensive. So we haven't had a drug company step up to the plate and, you know, buy the proprietary rights to go ahead and do it as yet. We've had some feelers, so we're optimistic that that might be something that we'll see in the future.
Well, that's really terrific. So you have a very busy clinic, I know, and I know of many of your patients who, talk to me and have supported the Eye and Ear Foundation. Just tell us how much they appreciate your care, and you're obviously, uh, you know, uh, very, very appreciated by those you've served over the years. If you're looking at the things you've done in medicine and research and your academic work, and really had to tell us, what really stands out that you're really proud of, that you really feel, this is something that I can look back on and say I'm really glad that we accomplished. What's something you may, that really stands out?
Well, way back when I sort of popularized a specific kind of laser that's used in the clinic and also in the operating room. There were a lot of naysayers at the time that this would never work, and now pretty much everybody has one and uses it. They don't use it as much as they used to because lasers aren't used so much to treat disease as they were. But that was something that sort of changed ophthalmology in a reasonable way. So that was one thing. Also, did some work with respect to macular degeneration, the dry type, to see whether there was any kind of laser strategy that might help people with dry macular degeneration. So there was a big multi-centered study, and we were able to make some of the pathology go away, but unfortunately, it wasn't always beneficial. So that sort of strategy has not been used very much. It was sort of resurrected lately, and so we'll see how that's going to go. But that was one thing that I was pretty interested in, and it sort of dovetailed into my work with macular degeneration.
Macular degeneration certainly is, something that affects, so many people. And I know that that's something that that you spend a lot of time and your focus on. Do we see a point where, we obviously have answers for people now for wet macular degeneration? Do we see some things that may be helpful in the near future, or sometime in the future, for people with dry macular degeneration?
Yeah, I mean, I think there are some products or things in the pipeline that should slow the progression. But another thing that's pretty cool is some new visual aids for people with macular degeneration or any kind of visual field loss of any type. So using sort of modern technology, if you will, you can assess somebody's visual field, and then using electronics, you can display to them the world, but avoid the areas where they can't see. So there's some really cool things going on with visual rehabilitation, if you will, and I think they're going to work. So
Yeah,
I think people that have suffered from loss of vision, I think there's some really good hope coming their way.
well, that's good that's wonderful to hear. And I actually, one of the people we talked to recently was Holly Stantz, who's occupational therapist working in visual rehabilitation, and of course Will Smith, who's also treats a lot of our low vision patients. So it is wonderful, and unfortunately, not enough people do know about those. So we like to share that. So thanks for sharing that, because there is help there. That's one of the things that's an example of what's happening in the department. There's, we're really growing the department. A lot of new people, a lot of focus on things just like you mentioned in the rehabilitation and assessment and evaluation. And we've certainly grown significantly in the retina specialty area, as well as in retina research in the department. And you are the director of our Retina and Vitreous Services. So tell us about, some of the things that people should be aware of and maybe and maybe excited about related to what's happening in the department in these areas.
So, when I came here, I think it was no, I can't even remember. I think it was in the 1980s. Somehow, I've been here almost 40 years. So it was myself and Dr. Eller, the two of us, for many, many years. And then ultimately, the department got bigger. Dr. Sahel came, made a huge impact, and brought a lot of really smart scientific people as well as clinically savvy people. And so we have lots of areas covered. We have imaging covered. We have artificial vision covered with special retinal chips. We have genetic alterations, genetic therapy covered.
Mm-hmm.
When I say covered, there's people in the department that are working on these things.
Right.
And what's nice is to have the faculty members see what the other person is doing. We always get ideas from the other people. So it's really become a lot more fun, I guess you would say, mm-hmm. because we have lots of questions, and seeing what someone else is doing can give us an idea of how to go forward in our specific area. So I think Dr. Martel specifically is working on a very high-powered stuff, and Dr. Sahel as well. And many of my colleagues.
Yeah, I'm in a very fortunate position. I get to learn about all these things and report on them and tell people about them, and it's so exciting. And you're certainly in the center of a lot of it now. With you practice primarily at Mercy Hospital, and Mercy's now becoming sort of a an area where we'll be spending a lot more time in the somewhat near future, right. With the new facility. And so with the future of the department and where things are going and what Pittsburgh is doing, is there, what do you predict, or what do you think that people will be saying in the next 10 years about, ophthalmology in Pittsburgh?
I think we're going to become a center. I think, the COVID thing has obviously put everybody on a bit of a hold, but we have a lot of momentum. And once we have another facility that's a focus of the department with all sorts of things going on in the same facility, so we're shoulder to shoulder with our colleagues rather than spread out, I think it's really going to accelerate things. And I believe that our department's going to be really on the forefront of a lot of really good science and discovery. And as I think Dr. Martel mentioned, we're working not just within the University of Pittsburgh, but also other important institutions in the vicinity. So there's a lot going on. It's extremely exciting. And we have exciting graduate students, medical students, all sorts of people want to contribute. So that's a lot of fun.
Yeah, well, I think fun really is the optimum word. I feel that too. So, many things to look forward to, and obviously, it's wonderful for our senior faculty, and then also for all the we have a lot of younger faculty and a lot of people coming on that are adding to that excitement. It's a really good mix. So thank you for spending some time today. Those are all my questions. You answered them beautifully. And if you have anything else to add, please do. And again, thanks for spending time today.
Sure. Well, the only other thing I would like to add is I think it's, after being here for so many years, and some of my patients I've seen for almost 40 years, I think it's really important to get to know your patients, what their needs are, and get to know what they do and their issues, because it helps us become better doctors. So we can't let sort of our technology get in the way of the patient themselves. So helping patients really depends on connecting with them. And I'm hoping that I've connected with a lot of patients here in Pittsburgh.
Yeah, I know you have, and I think that's also really good for people to hear, in terms of you know the overall mission that we're on, and is really focused on helping patients. So thank you so much, and you have a great rest of your day, and we'll look forward to seeing you in person hopefully soon.
Thank you, Arnie.